Since ICE fully opened Camp East Montana in mid-August last year, the El Paso Fire Department has responded 130 times to the facility for medical emergencies, including January 4th, the day Cuban migrant Gerardo Lunas Campos died.
He tried to hang himself, and then we put him in cuffs, and he kept going.
The El Paso County's Office of the Medical Examiner later ruled Lunas Campos' death as a homicide, which ICE disputes based on their staff's response. Parts of the 911 call are redacted as the caller details what's being done at the moment.
And you said that he tried to hang himself, correct?
Yes, medical currently.
Is he awake?
Medical still on him with the AED, and I think he still has vomit in his mouth.
On January 14th, the fire department responded the same day Nicaraguan Victor Manuel Diaz died, which staff again reported as a suicide attempt.
Yes, we got a situation where they found someone that committed suicide or tried to commit suicide, and so we're working on them right now at the clinic.
Autopsy results aren't available as Manuel Diaz's body was taken to William Beaumont Army Medical Center, not the medical examiner.
Okay, sir, can you tell me exactly what happened?
You know what? We have a detainee here in observation in one of our urgent units, rooms in the medical clinic area, and they were doing rounds and they just found them with, I guess, his pants tied up to his neck, I believe. I was not the one that got here, but they're actually, like I mentioned, they're working on them now.
We've already seen 17 people die in ICE custody this year, which is an average of about 1 death per week. And I can tell you I've been tracking these numbers for several years now, including during the COVID-19 pandemic, which was another point where we hit a record number of deaths. And I have never seen anything like this, where I'm seeing ICE reporting out at least 1 death per week. It's really shocking. And of course, this comes on the heels of a record number of deaths in ICE custody last year, which also, doesn't include the number of deaths that have occurred as ICE has been chaotically and violently targeting immigrant communities, during their enforcement actions.
Today, ICE confirmed the death of a 3rd immigrant detainee at Camp East Montana on Fort Bliss in El Paso. ICE says 36-year-old Victor Manuel Diaz from Nicaragua was found unresponsive in his room on January 14th while in custody. Officials say his death is believed to be a suicide, but the cause is still under investigation. Camp East Montana is one of the largest detention facilities in the country, and this marks the 3rd death there in the past 44 days as members of Congress continue to raise safety concerns.
The Department of Homeland Security wants to convert 11 massive warehouses around the country into ICE detention mega centers, each one holding between 7,500 and 10,000 detainees. Every single one of these 11 warehouses faces critical problems with water supply, wastewater processing, that's i.e. poop, pee, or both. DHS plans 80 detention blocks inside, combined with kitchens, laundry, and staff facility that could produce over 1 million gallons of sewage and wastewater, poop water, every single day.
More than 30 people died in ICE custody last year in 2025. That is the highest tally in the agency's history since fiscal year 2004, over 2 decades ago. And so far this year in 2026, less than 4 months in, 16 people have already died in ICE custody. And so ICE, Mugo, is on pace to surpass that tally from last year and potentially set a new all-time high. We have seen multiple reports across the U.S. of substandard conditions in ICE detention, including reports of overcrowding, inadequate medical care, and also insufficient food and water. Also, because of Trump administration policies, it is now increasingly difficult, Mugo, for people in ICE custody facing deportation to be released on bond. And so the time people are spending in custody, in ICE detention, is going up. The Department of Homeland Security gutted and scaled back some of the internal watchdog agencies that historically have inspected detention facilities and conducted oversight. And lastly, I should underscore, Mugo, that the Department of Homeland Security has routinely and repeatedly denied any allegations and reports of substandard and poor conditions inside of ICE's detention system, and has maintained that the medical services offered by the agency are, according to the agency, the best health care that many detainees have ever received.
And Camilo, I'm curious, is that their recent response to this research, or have they not talked about this new study just yet?
That is the generic response that DHS has had every single time somebody has died in ICE custody, or when officials or advocates at the local level have reported about substandard conditions.
If this channel is new to you, subscribe and share your thoughts and concerns in the comments. Record today, protect tomorrow.